Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Gentamicin. Its brand name is Garamycin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Gentamicin. We'll then touch on examples of dosing and then finish it off with side effects. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So gentamicin is an aminoglycoside antibiotic. It acts by inhibiting microbial protein synthesis in susceptible pathogens. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used for bacterial meningitis or bacterial sepsis. Patients with an eye infection may use this medication in the ointment form. Patients with an infection of the bone or an infection of the skin or subcutaneous tissue may use gentamicin. Medication may also be used for several gastrointestinal infections, severe respiratory tract infections, as well as severe urinary tract infections. With respect to contraindications or reasons we would not be able to prescribe gentamicin to a patient, well, we wouldn't give this medication to a patient who had a hypersensitivity to gentamicin or to any other component of the formulation. We would also avoid this medication in patients who have a hypersensitivity to other aminoglycosides. Now for some examples of dosing with gentamicin. So in the treatment of bacterial meningitis, we may see 3 milligrams per kilogram per day given intravenously or intramuscularly in equally divided doses every 8 hours for 7 to 10 days. If it was a life-threatening infection, we may see 5 milligrams per kilogram per day, again IV or IM, in 3 or 4 equally divided doses. The patient would then, or the people treating the patient, would then reduce the dose to 3 milligrams per kilogram per day as soon as it was clinically appropriate. For the treatment of an eye infection, using the ophthalmic ointment, the patient would apply a small amount of the 0.3% ointment, so a half inch, topically to the affected eye or eyes 2 to 3 times per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using gentamicin, so we'll go over some of those here now. Just keep in mind that some of these side effects would be decreased clearly for the eye ointment. So some common side effects may be nausea or vomiting. Diarrhea may occur in some patients, as well as a decreased appetite. Some patients may experience pain at the injection site, a headache, fever, or joint pain. More serious side effects would be ototoxicity, nephrotoxicity, or respiratory tract paralysis. Alright everybody, that's all we're going to talk about today with gentamicin or Garamycin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.